Hi everyone, my name is Mia Harris and I did my flashcard presentation on glomerulonephritis. Glomerulonephritis is a group of kidney diseases that affect the glomeruli or the nephrites, which are the tiny filters inside the kidney. The glomeruli are responsible for removing waste and excess fluid from the blood. Glomerulonephritis can be caused by many factors, including infections or autoimmune condition, such as systemic lupus erythematosus. Glomerulonephritis can be acute or chronic. Acute glomerulonephritis can result from diseases within the renal system, or it can be secondary illness following an infection. For example, post-acute streptococcal glomerulonephritis is an example of acute glomerulonephritis, which may develop suddenly about 10 to 14 days following an upper respiratory infection such as strep throat that is caused by the group A beta hemolytic streptococcus bacteria. If acute glomerulonephritis is not treated in time, it can progress to chronic glomerulonephritis, which is characterized by irreversible and progressive glomerular damage and tubular interstitial fibrosis, leading to chronic kidney disease and end-stage renal failure if not treated. Pathophysiology. The glomerulonephritis involves inflammation and damage to the glomeruli, like I said, which are the tiny filter or structures responsible for filtering the blood and removing the waste, toxins, and excess fluids from the blood. This inflammation of the glomeruli can be caused by infections, autoimmune response, or an underlying condition in the kidney. For example, with autoimmune glomerulonephritis, the immune system mistakenly attacks the glomeruli, causing the pro-inflammatory cells and proteins to accumulate in the glomeruli, which leads to swelling and damage to the glomerular capillaries. These are the tiny blood vessels within the glomeruli. As the inflammation and damage progress, the glomeruli cannot filter the blood effectively, which can cause reduction in the glomerular filtration rate. This can lead to the retention of excess fluids and waste products such as the BUN and creatinine and other toxins in the blood. If the inflammation is not treated, it can cause scarring and fibrosis of the glomeruli, leading to chronic kidney disease and end-stage renal disease. Risk factors, infection, like I said before, particularly the streptococcal infection, such as the strep throat, can create an antigen-antibody complex that lodges inside the glomerular capillaries and activates the complement system to cause an inflammatory response in the glomeruli of the kidney. Autoimmune conditions such as the systemic lupus is a risk factor because the autoimmune condition, like I said before, the immune system mistakenly attacks the various organs in the body, including the kidney as well. So this is a risk factor if you have an autoimmune disease like the systemic lupus. Family history. Having a family history of glomerulonephritis can increase the risk of having glomerulonephritis. Age and gender. Risk of glomerulonephritis increases with age. As people get older, everything slows down, including the function of the body organs slows down as well. Also, some forms of glomerulonephritis, such as the IgA nephropathy, are more common in young men, in young adult males. Chronic diseases such as diabetes is a risk factor for glomerulonephritis, and hypertension as well, because diabetes and hypertension can damage the glomerular capillaries, leading to glomerulonephritis. Medications and toxins. Some medications such as the steroidal anti-inflammatory drugs, the NSAIDs, and some antibiotics have been associated with drug-induced glomerulonephritis, as well as exposure to environmental toxins. Major signs and symptoms: proteinuria, which is a protein inside the urine, is a sign of glomerulonephritis. So proteinuria is caused by the inflammation, as the inflammation causes the glomerula to become permeable, allowing protein such as albumin and blood to enter the urine. So this will cause protein in the urine. Hematuria, which is blood inside the urine. This is due to damage to the capillaries of the glomerula, and this causes increased permeability, which causes blood to enter the urine as well. So coffee color urine. So with blood and protein in the urine will become coffee color. This is a sign of glomerulonephritis, or the damage to the kidney. Edema, so swelling of the hands, the feet, the face, and the ankles. This is due to fluid retention, which is caused by impaired kidney function. Hypertension is a sign of glomerulonephritis because in response to the decreased glomerular filtration rate, the renin-angiotensin aldosterone system is activated, which causes the blood vessels to constrict, and the kidney retains more sodium and water, which contributes to the high blood pressure. Decrease in urine output can be noted due to decreased urine production and fluid retention by the kidney. Fatigue and weaknesses can also be noted as well. This can be caused by anemia, which is a low red blood cells due to the decreased erythropoietin production by the kidney. Fluid overload, accumulation of excess fluid in the body can lead to shortness of breath and weight gain. What else? Diagnosis testing. The glomerular filtration rate below 60 indicates poor kidney function. Urinalysis can be done, which will reveal hematuria and proteinuria. Like I said before, these are blood and protein in the urine. 24-hour urine collection will also be measured to assess the amount of protein and creatinine in the urine over a 24-hour period, which will assess the kidney functioning. The blood urea nitrogen and creatinine will be elevated. So these are the waste products. So the blood urea nitrogen is a waste product that results after ammonia, which contains nitrogen, breaks down protein to be used by the body. Creatinine is a waste product of creatine, which is a chemical made by the body and used to supply energy to the muscles. So with the damage to the kidney, we'll have elevated creatinine and BUN in the blood. What else? The serum albumin level will also be low as well, which will indicate protein loss in the urine. CBC, the complete blood count, will reveal anemia due to the production of low red blood cells by the kidney. Also, the autoimmune infectious disease marker is also a diagnostic testing because this is a blood test that will test the level of the anti-DNase B and the streptococcal antibiotics in the blood. So the kidney ultrasound can also be done to check for structure abnormalities in the kidney. Kidney biopsy can help to determine the specific cause of the glomerulonephritis. Electrolytes A metabolic panel can also be done as well to assess the level of phosphorus, potassium, and chloride in the system, which will become imbalanced due to the poor kidney function. So this is the end of my presentation. These are my references. Okay, thank you.